In the world of rehab, you hear two terms thrown around all the time: occupational therapy and physical therapy, OT and PT. They sound kind of similar, and honestly, they often work with the very same people. So, what's the actual difference? Well, it turns out their approaches are super distinct, and both are absolutely vital. Today, we're going to clear it all up.
If you've ever mixed these two up, trust me, you are not alone. After an injury or an illness, both are total cornerstones of getting you back on your feet. You see, they share the same ultimate goal: helping people get their lives back. And that's exactly why they get confused so often. So let's untangle this and see what makes each of these amazing fields so unique.
Here's how we're going to do it. First, we'll define each profession. Then we'll dive into their core differences, see how they team up in rehabilitation, figure out how to choose the right one for you, and finish up with a big takeaway. All right, let's build from the ground up. Before we can really compare them, we've got to understand what each one is all about. So, first up, physical therapy.
Okay, so physical therapists, or PTs, they're basically the body's mechanics. You can think of them as the movement experts. Their main job is to figure out what's limiting your ability to move and then treat it. We're talking about improving your mobility, getting rid of pain, restoring your physical function, and just generally preventing long-term disability.
Now, what about occupational therapy? The name itself can be a little confusing. Here, occupation doesn't just mean your 9-to-5 job. It means any meaningful activity you do in your daily life. OTs take this really holistic, big picture view, helping people do these daily occupations, whether that's getting dressed in the morning, cooking a meal, or getting back to a hobby they love.
I absolutely love this analogy because it just makes everything click. It perfectly shows the difference, right? A PT is focused on that fundamental movement, the walking itself. The OT then takes that movement and helps you apply it to a real-life task, like walking to the kitchen to make that cup of coffee. One gets you moving, and the other helps you use that movement to actually live your life.
So with that in mind, how do these two really stack up against each other? Let's go head to head, because this is where the differences become crystal clear. This table really just lays it all out, doesn't it? Look at the primary focus. PT is all about those big movements, the gross motor skills. OT, on the other hand, zooms in on fine motor skills and the ability to do daily tasks, and that focus flows right into their main goals. For PT, it's about restoring physical function and kicking pain to the curb. For OT, it's about independence. It frames their whole philosophy. The PT is the movement expert, and the OT is the creative, holistic problem solver. So what does a PT session actually look like? Well, it's all about targeting the body's mechanics. You're going to see specific exercises to build strength, hands-on therapy where they physically manipulate your muscles and joints, and a lot of work on balance and walking. Every single thing they do is designed to get your body moving the way it's supposed to. Now hop over to an OT session, and the focus totally shifts. It's less about the body in isolation and more about the task at hand. An OT might help you figure out new ways to get dressed, recommend things like grab bars for the shower, or work on fine motor skills so you can write again. They're amazing problem solvers who adapt the environment to fit you, not the other way around. You know, they both work in a lot of the same places. As you can see, hospitals and outpatient clinics make up a huge chunk for both. But check this out, that 20% for schools and home health. OTs have a massive presence there, and in mental health settings too. It really shows you just how broad their scope is. Now, this next part is so important to understand. OT and PT are not competitors. They're not rivals. In reality, they are powerful allies on a patient's recovery journey. They're a team. For all the ways they're different, the common ground is huge. I mean, at the end of the day, both are completely dedicated to improving a patient's quality of life with personalized one-on-one care. They educate, they set goals, and we got to remember, both are highly trained pros who need advanced degrees and state licenses to do what they do. This is the perfect example of their teamwork in action. So for someone recovering from a stroke, a PT is going to focus on rebuilding that physical foundation, getting muscles stronger, improving balance, learning to walk again. And right alongside them, an OT is going to help that person apply those new skills to real life, like figuring out how to button a shirt with limited dexterity or how to move around the kitchen safely. It's a true 1-2 punch for a full recovery. Okay, so with all this info, how do you know which one is right for you? Or, hey, if you're a student, which career path might be the better fit? Let's break that down. The choice really comes down to your main goal. Is your biggest challenge a specific physical limitation? Like, you have pain when you bend your knee, or you just can't lift your arm, that is classic PT territory. But if your main struggle is with doing a daily activity, and the barrier could be physical, cognitive, or even environmental, then an OT is the expert you need to see.
And for all of you out there maybe thinking about a future in healthcare, which one of these roles just sounds more like you? Are you fascinated by how the human body moves, the biomechanics of it all? Or are you that creative problem solver who just wants to help people live more fully, no matter the obstacle?
But here's the really great news for anyone thinking about these fields. Job security is fantastic. The demand is incredibly strong. You can see here both PT and OT are projected to grow way faster than the average for all jobs. I mean, as our population gets older, the need for these experts is just going to keep climbing.
Okay, we have covered a ton of ground. Let's bring it all home with the final, most important takeaway of all.
Ultimately, even with their different methods and their different areas of focus, they share one incredibly powerful mission: to help people live better. PT focuses on improving the body's ability to move. OT focuses on improving a person's ability to do the things that give life meaning. Both are absolutely essential.
So I'll leave you with this to think about. Is it about restoring the movement itself, or is it about adapting life's activities? Which approach to healing and independence really speaks to you? It's a question that gets right to the heart of what it means to recover. Thanks for tuning in.